So this event is a hugely exciting one, actually, because it brings together senior leaders and people working on the ground in organisations across the west of England, commissioners and delivery partners from both the health and employment sectors and crucially the skills sectors. This event, we hope, will give us the opportunity to begin to consider how we can work together to improve employment and health outcomes for the populations that we serve, and particularly those who have health conditions and who are furthest away from employment. The recent Green Paper, which we'll hear about this morning, Work, Health and Disability, Improving Lives, highlighted a 32% gap in employment rates between disabled and non-disabled people. More than half of ESA claimants in the west of England have a mental health condition. Our speakers this morning will draw a fuller picture of the impact that these and other statistics have on people's lives and some of the challenges and, of course, some of the opportunities they present. The first session this morning, which will run up until the break, will be a series of presentations looking at the national and local initiatives and the needs and opportunities for us to develop new ways of working. How one area of the country has tackled these, Sheffield's, and how we can affect positive change, particularly focused through partnership working and the opportunities that that brings. There will be time for 2 or 3 questions for each of the speakers, and they've agreed to take some at the end of each of their presentations. But if we don't have the opportunity to get to everyone and there are further questions, either during the talks or subsequently to that, then please use the pieces of white paper that we have at the back to write down your question on a post-it, put it up there against the relevant session, and we will then follow those up on your behalf and get back to you with some discussion or some answers. So I'd just like to thank and introduce our speakers for this morning. First of all, you'll hear from Councillor Hance, who is the Cabinet Lead and Member for Health and Wellbeing here in Bristol. We'll then hear from Shelly from the Department of Work and Pensions. Just want to reassure myself that Shelly is here. Thank you very much. Who'll be talking about the Green Paper and the national perspective on this work and the link between health and work. We'll then hear from Leo Capella, Anna Denham and Charlotte White, who are sat at the front here, from Disability Rights UK. And their talk is entitled I Can Make It, Sustainable Employment for Disabled Young People, focusing on promoting equality in employment through commissioning and procurement. We'll then hear from Chris Shaw. Thank you, Chris, for making the journey down from Sheffield, who is the Head of Health Improvement at Sheffield City Council. His talk, Employment, Health and Disability in Sheffield City Region, we'll be talking about the partnership working that they developed in Sheffield and how that's driven change. And then we'll hear from Joel Readman, who's here in his capacity as the Responsible Officer for Employment and Skills for West of England Devolution, talking about the challenges and opportunities associated with this agenda across the West of England. So thank you all in advance for your contribution. Thank you to all of you for making the time to come along today. My colleague Jan Connett will talk about the table discussion sessions that will take place after the break. But what I would also like to highlight at this early stage is that inevitably for an event like this, with so many people in the room, there are a lot of people here who have worked together before, but a lot of people here who will not have worked together before and may even not have met before. So please do regard this as the beginning of a discussion, the beginning of a dialogue across and between organisations and individuals. Please do take the opportunity to use the networking time that we've tried to build in, and I hope that you find the event positive, not just in terms of the content, but in terms of the relationships and the subsequent collaborations that develop. Okay, thank you very much for listening to that introduction. I will now invite Hance to come up and begin the morning. Thank you.
Well, welcome everybody. On behalf of the City Council, I'd like to thank everybody for making it here today. It's been a spectacularly nasty day out there. Bristol never fails to disappoint in the wetness stakes, I think, but who needs to wash when you've got the rain? I think we can all judge how important this issue is by the large number of people here. There's people from right across the west of England, from a large number of organisations. We're probably all aware of the research that shows how work and income are major determinants in health, well-being, quality of life and life expectancy. But the relationship isn't simple, it's quite complicated. I've just been asked to run through a couple of the the facts and figures that we already know. Musculoskeletal and mental health conditions are major causes of unemployment and sickness absence. And both of them share characteristics in that they're often invisible to the naked eye, to the outsider, and they're often very hard to get early diagnosis and treatment for. Sickness, absence and unemployment have economic costs as well as personal costs for individuals and communities. In 2012, it was estimated that in Bristol, the cost of sickness was in the region of £240 million every year. Not only that, of course, but being out of work and not being able to find a suitable job can have a profoundly negative impact on people's health and well-being. And work can help. Good work, which allows people to learn and develop and achieve, has a positive impact on physical and mental health and mental well-being. But we also know that insecure, low-paid and unsafe work has the opposite effect and can even drive people into ill health. We also know that there's a significant and unacceptable gap in employment rates between disabled and non-disabled people. And that really is a problem when we look and see that 1 in 3 of our working age population has a long-term health condition. Many people with long-term health conditions are in work, but many are not, even though they could be. And just to be clear, this is absolutely not an exercise in forcing people into work when they're unable to do so. Some of you may know I used to work for the local MP. I worked as a caseworker for 9 years. And frankly, far too much of my time was spent helping people access the benefits which they deserved. So this is definitely not about demonising people who are unable to get into work. What we're looking at is seeing how we, from our different organisations, can support people appropriately into the kind of work that will benefit them and will benefit the communities around them. We do need to get our act together, though. The percentage of the population living with long-term health conditions will rise as the population gets older. And this means that managing health conditions in the workplace and making those workplaces more accessible for people is going to be essential. Additionally, the West of England, we've done quite well economically. We've been very successful in attracting inward investment and creating jobs, but there are many people across our region who simply haven't benefited from those economic benefits. And so we still have persistent economic and health inequalities in this city that really don't seem to be going away. So none of us can resolve these issues alone, as David was saying. We need to work collaboratively, using our different strengths, and that's no mean feat, because as I said, there's lots and lots of different organisations in this room, and we all have different work cultures and different ways of working, so it's not simple. It's complex, and I doubt very much we'll come up with the answers today, but we are making a start. And what we want to do today is just to start a conversation about what we can do to improve the opportunities and the health outcomes for everybody who lives and works in the West of England. So, here we go. Let's try and embrace the challenge. We've got a number of really interesting speakers coming to talk about the practicalities of how this might work, rather than some politician talking about vague rhetorical points. So I'm really interested to see how it's going to happen, and I believe, Chris, you're on next, aren't you? Is it? No? Got that bit wrong, didn't I? I've got the agenda in front of me. Who is it? Is it you? I'm sorry. Thank you. I'm sure you have some very useful, interesting things to say. Thanks very much.
Yeah, thank you. I'll load up your slides, Shelley. So thank you very much for that introduction fee. Is that the first one you're expecting to see, Shelley? In which case, welcome to the stage. Please come up. Thank you very much indeed for making the trip down, and I look forward to hearing about the Green Paper.
Thanks very much indeed. So I've arrived just in time. I think you might have seen me slip in. I'm a veteran commuter of Southern trains, so I wasn't surprised by a delay on any train this morning. But anyway, thank you very much anyway for the opportunity to come and speak to you today. My name is Shelley Fuller. I work in something called the Work and Health Unit. And that is a unit that was set up about 18 months ago, which really demonstrates the government's commitment to this agenda by combining staff from the Department for Work and Pensions and Department of Health for the first time to work together. I'm here to talk to you about our Green Paper, Improving Lives, the Work and Health Disability Green Paper. There's quite a lot to get through. This is the Green Paper. You can see it's quite a weighty document. Some people have suggested that it's actually 3 green papers in one. So as I said, quite a lot to get through. So just to start off, what will it take to transform the employment prospects of disabled people and people with long-term health conditions? As we've heard, the employment gap between the non-disabled people and disabled people is 32%. So we've got an employment rate for non-disabled people of 80% versus a 48% rate for disabled people. And the reality is that disabled people make up only 10% of 31 million people who are employed. The rate also masks a very high disparity in individual rates. So, for example, individuals with mental health conditions the gap is 36%, but disabled people with higher education are more like non-disabled people. Sorry, I should have said that's the employment rate is 36%, not the gap. I think the gap is actually slightly smaller in the West of England area, judging by the statistics I've seen earlier, but nevertheless, the gap is too wide, and the government wants to do something about it. It's unacceptable in 2017 that 4.6 million disabled people and those with long-term health conditions are out of work when the health and wider societal benefits of work are much better known. Every individual should be able to access the right support at the right time. And it's therefore disappointing that the health and benefit systems can often be seen to work against each other. So the government believes that the early intervention is the key and prevention is the key. Disabled people and those with a long-term health condition are disproportionately more likely to enter the benefit system, and that likelihood increases with the length of absence. And on average, someone who is off work for 6 months or more has an 80% chance of being off work for 5 years. So as I said, that early intervention is crucial. We do recognise that the right support is not always readily available to help people return to or stay in work, and we think our systems would benefit from closer integration, ultimately benefiting those people who use our services. But to emphasise just how big the challenge is, halving that gap would mean getting 1 million more people into employment, all other things being equal. So effectively, we'd have to stop non-disabled employment to actually achieve that. So just to move on to this slide, which shows the case for action, it highlights why we're taking a new approach in this green paper in covering both health, employment, and welfare together. So we know that work is good for health and vice versa. So the infographics that this slide show highlight the positive link between work and health. So while work is beneficial to health, you can see that there are issues. You can see that treatment times vary across areas. 1.8 million employees with a health condition require sickness absence of 4 weeks or more in a year, and disability is rising. And only 8% of employers report they've recruited someone with a disability or a health condition over a year. Conversely, worklessness is associated with poorer health outcomes. Unemployed people have higher rates of physical and mental health conditions, are more likely to be on medication, use medical services, and often live shorter lives. And only 3 in 100 people leave employment and support allowance each month. The costs are also huge. Ill health costs the economy about 100 billion every year, costs employers 9 billion, and the NHS 7 billion. So having talked about the challenges in employment and challenges in health and welfare, this slide shows something about what we are wanting to achieve. Effectively, this is the green paper on a page. It's a vision that puts the individual right at the centre, as you can see, and it's a vision of a society where everyone is ambitious, and for disabled people and people with long-term health conditions, and where there's a universal understanding of the positive relationship between health and work. So we want to see inclusive employers providing opportunities to secure a job and progress within it, and actively supporting, nurturing the health and well-being of their employees. We also want to see more effective health services and healthcare professionals who support people to achieve their employment aspirations, and also employment support systems for those out of work. So working in tandem, these improved systems will ensure individuals, regardless of where they are in their journey, are able to access the right support to help them remain in or find work. But of course, in central government, we can't make the huge cultural changes necessary to realise this vision all on our own. And we don't pretend to have the answers about how we're going to make these transformative changes, which is why we need your help. So the Green Paper is reflecting the government's new and ambitious approach to work, health and disability, And the government wants to join up systems, change attitudes within the welfare system, across the health service, and also with employers and across the wider society. That way, more people would be able to benefit from the positive impact of health and well-being that appropriate work can bring. In the Green Paper, we restate the government's aim to transform delivery of occupational health, related interventions and support, which is not as effective as it should be. And of course, the publication also marked the start of a public consultation that's running until the 17th of February. And really what we're trying to achieve is to spark a far-reaching debate so that the issues and the proposals in the Green Paper mean that we then listen to what we can develop for the future. It's been a very long time coming. We're delighted that the early signals are that the Green Paper has been well received, and we're really grateful to everybody internally and externally who've worked to actually develop this Green Paper. So to move on to this slide is actually showing the key consultation themes. I'll just pick out a few. So first of all, what will it take to reinforce work as a health outcome in commissioning and clinical practice? How big a role should employers play? How can we develop the better occupational health support right across the health and work journey? How can we improve the welfare system that leaves the support group in employment and support allowance without any access to employment support? And how can we ensure good quality conversations about health and work and improve how the fit notes work? Employers, as I mentioned, are one of the three areas we're specifically interested in looking at. They have a huge role to play if we're to halve the disability employment gap. And more needs to be done to get employers recruiting and retaining the services of disabled people and those with health conditions. The chapter in the Green Paper that deals with employers has three main elements. How to embed good practice and create supportive cultures, how to help disabled people and those with long-term health conditions move into work, and how to help people stay in work. There are a number of announcements in this chapter, and the government has announced the creation of a disability confident business leaders group to increase engagement around disabled employment, and that was starting with FTSE 250 companies. And Job Centre Plus have also been commissioned to facilitate UK-wide roundtable discussions to build an understanding of the issues that SMEs face, because of course one size does not fit all. Also, leadership in the public sector is extremely important, and to emphasise this, all government departments have now signed up for Disability Confident. But it's also quite a green area of the Green Paper. We're asking a lot of questions in this area. So, for example, what are the barriers to recruitment and retention? And we want to know from different sizes of companies what those barriers are, because as I said, one size doesn't fit all. What measures would support employers, regardless of size? Also consulting on statutory sick pay reform, and with a view to it promoting phased returns to work. But we're also asking that broader question about what expectations should we be placing on employers? What role should they play in halving the disability employment gap and helping people with long-term health conditions? So moving on from employers to health. As I mentioned, the impact of working age ill health on the NHS costs £7 billion a year. It's very significant, especially in the context of funding challenges. So, of course, we're dealing with some really big issues with health services in the Green Paper. Among the announcements are a review of the fit note. We're asking how we can improve those health and work conversations between a clinician and a patient for the benefit of the patient and employers. But we're also asking whether other health professionals besides doctors and critically GPs should be able to sign the fit note. We're also announced an increase in employment advisors in talking therapies, and also trials to test health services and support that are effective. We want to see how health service can help employment aspirations of the people they're treating. We've also announced the intention to bring work as a health outcome into clinicians' training and thereby making the link between health and employment as backed up by the evidence. And we're asking how best to get healthcare professionals, commissioners, promoting work as a health outcome. And also we've announced the intention to increase capacity in occupational health. While not as green as the employers chapter, we are asking quite a number of questions in this area. So we're consulting on how we can transform the occupational health landscape, making it better matched to individual need, complementing employer provision and extending occupational health services to all. And crucially, that includes the unemployed and the self-employed, not just employees. We're also wanting answers to how we can bring evidence together in one place so that commissioners and local delivery partners have them available to them. And we're also asking about improved sharing of employment and health data, innovation, co-location, and local networks in order to support local service integration. So I think we're at a critical juncture, which provides a unique opportunity to rethink the existing offer of support. And ultimately, the consultation is exploring how we can get health and the welfare systems working better together in the future. And finally, I think it's probably worth emphasising here, and you'll know this yourselves, that this is a very devolved system, and change, therefore, will probably be needed at the local level if we're to be able to actually have success in this area. So moving on from employment and health, the third area that's covered in the Green Paper is about supporting people into work, so dealing with people who are currently not in the labour market. We want to make sure that people with health conditions and disabilities have the same opportunity to benefit from the positive impacts work can give. So in this area, we're developing more tailored and personalised support, which is more focused on individuals' needs. The government's announced a wide range of policies so that a work coach can assess the needs of individuals and decide what support they need to be referred to. So just to pick out some examples, there's the Work and Health Programme, peer support club, job clubs, work experience, and a new work and health conversation in employment and support allowance. Overall, what this is doing is putting the work coach right at the centre of the process. So because of that, we're also consulting on how to build work coach capability to ensure they have the necessary skills. I think one of the key points here is that 1.5 million in employment and support people in employment and support allowance in the support group, that's 64% of those on ESA, don't receive any help and support in employment. So we're consulting on this and doing quite a number of trials to actually see what works. Also in this area, the government is committed to assessing people with health conditions and disabilities fairly and accurately, and hence that's why we're keeping the whole work capability assessment process under review. In the Green Paper itself, we're consulting on that reform, including on how we separate the decisions on financial support and employment support, and also other measures to simplify the assessment process and how to better share information and evidence. So just to close on the consultation, as I said, it runs until the 17th of February. We really want your views. I think last time I looked, we have on our citizen space individuals sort of submission service, we had about 640 responses from individuals. That's increasing all the time. It may have racked up quite a number more since I last looked last week. We're also having stakeholder events just like this one that we're attending, and we're also holding our own specific events directly through the Work and Health Unit. So you can get in touch through, as I said, Citizen Space. You can tweet us using Work and Health, and you can also email the address which is on the screen, or write to us at the Work and Health Unit. I think just to sum up finally, this is a really long-term agenda. We see this as a 10-year programme of reform. Some of the things are happening now, but some of the things are going to take quite some time to develop. It's one that's informed not only through the consultation and trials, but also through existing and forthcoming programmes. So, for example, I mentioned the Work and Health programme. So I'm not sure whether we have very much time for questions. We do have some time for questions, potentially. But if there's any I can't answer, because as I said, it's a very very weighty document. I'm not an expert on all of it. My area is largely FitNote and the Fit for Work, the National Fit for Work service, but if I can't answer now, I can always follow up later, and if there are any questions you have subsequently, then obviously put them on the post-it notes. Thank you.
Thank you very much. We've got time for 2 or 3 questions now. So we've got a mic which we'll get to you if you would like to make. Does anybody want to ask a question? Please put your hands up if you do. Okay, I've got one. So it's really about the kind of the thing that struck me as interesting about a lot of these sorts of challenges is how do you kind of strike the balance between setting, if you like, a sort of national standard and a national set of aspirations, and allowing localities, however they're described, health economies is the current jargon in the NHS, for example, to kind of be more ambitious, and how you then deal with the subsequent variability that, if you just leave these things to work at local level, inevitably will result. So how are you kind of thinking about that at DWP level?
Yeah, so really good question. I think we are thinking about that a lot. I think what we do understand is that it is going to be the bottom-up, local level up sort of solutions and integration of systems which are really going to deliver the answers. We are looking at innovation through the Innovation Fund. The Work and Health Unit has £115 million to support trials and various projects through an innovation fund. Yeah, it's a good question. I mean, I don't think we've got the answers yet. That's why we've got a green paper. That's why I reference it being quite green in areas. But it is, yeah, it's a challenge. But I think because we have approached this in a new way by bringing work and health together and talking at a local level, I think we understand that one size does not fit all, and I think that sort of looking at devolved areas and the future provision is key to actually achieving success.
Thank you very much. Okay, this lady here, please. Thank you very much.
I don't know specifically, but I can find out for you. Because we are sitting within the Work and Health Unit and we have extremely close links with NHS England, they are actually holding some events for us. My best estimate is that we've got a very close link with them. But if you write it on a post-it note, then I'll come back to you.
Okay, yeah, one more. This gentleman with the red jumper.
I suppose I want to ask why all the focus on disability? All the statistics indicate that growing numbers of the proportion of the population are going to have significant periods of their life living with disability. If you over-dramatise it for employers and for those who acquire a long-term health condition, it becomes a major crisis and leads people to think I have to completely change my life, leave work, and rebuild my life anew. Surely the focus should be on making it a process of transition and continuity, both in terms of someone who is moving into a life with a long-term health condition or disability, and for employers who are retaining skilled workers who happen to need reasonable adjustments in the workplace.
Yeah, I mean, I think it is about that. I think the focus on disability is because it's so stark with the disability employment gap. But we are also talking about long-term health conditions, and we are looking at this as the ageing population, increasing numbers of disabilities within the workplace and long-term health conditions. So I think it's a really good point, and I think that our approach is to encourage employers and everybody else working in this field to understand that we are dealing with the reality. It's not something new. This is the reality. This is the future that we are dealing with.
Okay, thank you very much indeed, Shelley. I'll get the other slides up. But in the meantime, thanks for everyone here. Thank you.
Thank you very much. Can you all hear me okay at the back? Yeah, thank you, brilliant. Well, my name's Anna Denham. I'm from Disability Rights UK. I'm here with my colleague Leo Capella and our Bristol champion Charlotte. You'll be hearing from Leo and Charlotte in a moment. Thank you to Jan and her team for having us here today. Okay, basically a little bit first of all about our organisation. So Disability Rights UK, our head office is in Old Street, central London. But we are a national charity. We work throughout the UK to support disabled people. Our vision is equal participation for everyone. We want a society where everyone can participate equally. And we have 3 strategic priorities running at the moment up until 2019. They are independent living, career opportunities, and influencing public attitudes and behaviours. Now, the I Can Make It campaign, which we're here to talk about today, to some extent does actually go across strategic priority number 1 and number 3, but primarily focuses on the second one, which is about career opportunities. So, what is I Can Make It? Well, in a nutshell, it's Disability Rights UK working in partnership with commissioners and procurement teams in local authorities, the NHS, CCGs, and your service providers. We're going to help you, hopefully, to find where the jobs are, the employment opportunities for young disabled people, and how you can create those jobs and make them work. So if you like, we're the kind of missing link. And we're using the Social Value Act, and also to some extent the Equalities Act, to make that happen. So the business case for employing disabled people. Why would you want to employ disabled people? Well, first of all, if you have disabled people in your team, you have a more diverse workforce. You have people with different experiences and different perspectives to bring to your organisation. We obviously want people to move away, if possible, from welfare support as much as possible and get them to be able to contribute financially to society. And as Fee and Shelley have already mentioned before, good work obviously is beneficial to people's health and to their well-being. So not only is that good for the individual, it's good for their support network, their friends, their family, and also for the wider community. And by helping young disabled people into work, we'll actually be helping 2 groups that are currently disadvantaged in the labour market. That's disabled people, but also young people. But why are we looking at public procurement in particular? Why are we just not knocking on doors of businesses and asking them to offer jobs to young disabled people? Well, as we know, in 2015, the government won the general election with a manifesto commitment to halve the disability employment gap. I won't talk about it too much, obviously, because Shelley's covered that brilliantly, but we know there are limits to this. We obviously want to support it, we want to see it happen, but we know that there are limits. First of all, there aren't enough jobs available. Second of all, there isn't enough employment support, and what is there has proven to be ineffective. I won't dwell on this too much, it's quite a lengthy report, but you're very welcome to go to our website and have a look. There is an executive summary, which is much shorter for you to read. But this report was launched by us in Westminster last month, and it has the backing of several MPs and peers across the different political parties. In a nutshell, some of the recommendations from that report are that addressing the disability employment gap must become the responsibility of all government departments, not just the responsibility of DWP. Last financial year, the government spent £242 billion on purchasing goods and services, and in 2014, local government procurement spending was approximately £45 billion. That's approximately 1/4 of local authority spend. So we can see that there's a significant amount of money being spent here, therefore a significant opportunity for employment. It's an area that's not being tapped into. Now, to move a little bit further on to how I Can Make It works, in a nutshell, we're targeting 13 cities, and I'm proud to say Bristol is one of those cities, and we already are in talks with Bristol City Council, but we're very keen to work with CCGs and NHS departments as well. The idea is that we recruit a champion in each area. Charlotte's our Bristol champion. And this is a young disabled person who can give you the support and the knowledge that you need to make this happen. We obviously need to listen to young disabled people to find out about the barriers they're facing, not just in finding work, but actually maintaining those jobs. And the champion will engage with you with our support to help you find the right service providers and the right jobs for those young disabled people. Typically what happens is the organisations that want to work with us get in touch, we have an initial meeting, and we ask you, you're the procurement experts, you're the commissioning experts, and you know what's going on in your local community. So we ask you, what kind of things, what projects are in the pipeline across your different services? Which contracts are going out to tender? What are the local demographics? Do you have a higher than average disabled population? What are you already doing in the disabled community in your local area? And how can we bring all of this together, your organisational needs, our commitment to getting more young disabled people in work, to actually make this work, to make it happen? And what we're offering in return? Well, first of all, this is completely free of charge to you. We're funded by Comic Relief, so there's no charge to any of the local authorities or organisations we're working with. We will help you establish best practice. We will support you, not just the local champion, but the I Can Make It team in head office. We can help you with best practice. We can signpost. We have toolkits. We have a model clause for contracts which we can share. And we also have a networking event, which is a kind of an exchange of ideas, a bit like today, coming up in March, which participating organisations will be invited to. And I'm now going to hand over to Leo and Charlotte to talk about the volunteer champions who are pivotal to making this happen. Thank you.
Good morning, everyone. Thank you for inviting us. I'm now going to talk about I hate using this term, young people with disabilities and health conditions who are the real stars of our show, so to speak. The young, I Can Make It volunteer champions. Now, okay, so what do they do? They arrange meetings with key decision makers such as yourselves in businesses and local government across our target areas. They also work with decision makers, which is why we have Charlotte here today. Our main mission is on this slide, but I'd also like to add to this that we are also working with our champions on other projects pursuant that are around our aims, including on how to improve make interviews more accessible. So here's two lovely photos of our champions in action. We have the one on the left is of one of our champions for the Birmingham area. This was taken at an event to recruit more volunteers in the Wolverhampton area, where we also have contacts. And the one on the right is actually two of our finest champions from our finest section in Manchester, Will Case and Catherine Woodhead, meeting with representatives of Salford City Council, where we're developing a good, strong working relationship with them and the Social Action Network. And our champions are a diverse group of people, and they are the ones who, to be honest, should be doing most of the talking. So, Charlotte, without further ado, may I introduce you to this wonderful audience.
So, as we've all heard, it's time for change, and I'm sort of readily available to work with any local businesses and organisations and city councils to facilitate implementing this change. This could be anything from coming to your office and seeing what it's like for wheelchair users to move around in that space, or it could be working with you when you're at procurement level with jobs to make, from stage one, the job more accessible so anyone has the option to apply. Because at the moment, a lot of disabled people are limited to what they can apply for, whereas if that was changed from day one, it would happen easier. I am a newly qualified social worker, so I have quite a breadth of knowledge, and I work with quite a lot of different organisations and charities. So I'd be more than happy to share that with any of you here, and yeah, to work with you.
Thank you, Charlotte. That was brilliant. Okay, we've done a lot of interesting stuff so far. We've met with the former Minister for Disabled People, Justin Tomlinson. We've also created an apprentice in Hull City Council who's called Luke Johnson, who is working in their procurement department as it's Hull is the UK capital of culture. We've also used our champions to engage with local government officials across England, including Durham and City Council, where one of our volunteer champions, Jonathan Mears, is deep at work with them. Should mention that I'm on the Disability Rights UK is a disabled people's organisation, which means that most of our staff has disability, myself included, Asperger's syndrome. So, thank you. Basically, we also do look at our I Can Make It webpage, where you'll also find some videos, both promotional under what is called I Can Make It Present. And there's two case studies of young people with disabilities and health conditions in work. One of whom is actually Jasmine Hart, is actually someone who works in the southwest and is actually, it will be familiar to some of you, who actually appeared on a BBC Three documentary, looking for a PA, personal assistant. And as Anna alluded to, we've done a lot, but we've got a lot more stuff, different things to do, including meeting more people. But here's partly why I'm here. We need more people like Charlotte to cross our target cities and to help Charlotte in Bristol. The criteria is on this slide. So basically we want people who really understand what we're trying to do and really want to make a difference to to their own prospects and the prospects of other people with disabilities and health conditions in their own target areas. So, our contact details are all on this final slide. Thank you for bearing with these little ghosts in the machine, and thank you for taking the time to look at us. And one more thing. We're talking about how to get halve the employment gap for people with disabilities today. One suggestion I would suggest is listening to people like Charlotte, as they and I should say we are the key experts at the end of the day. With your help, we can make a real difference to the lives of hundreds, thousands, and who knows, maybe even millions of people. Thank you.
My name's Chris Shaw, I'm Head of Health Improvement at Sheffield City Council. I guess my sort of 10penneth about this session today is a rather, probably, regrettably, a little more dry and organisational, in that it's about some of the sort of challenges and the sort of observations that we've had working on this agenda for a couple of years now. Some successes and some things to note. And I guess the challenge that was posed to me for the presentation was about basically dead straightforward, really a journey. Where did you start? Where are you going to? Where are you now? What have you learned so far? That's crudely simplistic, I realise, but it meant that it was quite easy to not be worried about what I was going to say, because I'm pretty much going to tell a story. So the journey, the destination, our location, what we've learned. Okay, very quickly. The journey really started with public health coming into the local authority and saying, okay, what does the local authority make of the public health agenda? And one of the things that came out of that was that they felt that it was wider than just a sort of behavioural context, and felt that the social determinants were important, and therefore things like housing and employment came in. So that was the very front end. We started developing that within the employment world in terms of the Sheffield's employment strategy within the city region, and then started to uncover things like the rate of unemployment related to health conditions and disabilities, and then started having a look at exactly what that meant and where we were. And so I guess the first thing that we did there was to develop a baseline study, get it built in as part of the first health and wellbeing strategy, do things around a pilot project, which is very much like the Manchester project, which was funded between ourselves, that's public health, and Job Centre Plus through their flexible support fund, a small pilot of people basically seeking to create a bit of a pathway and some learning from about how we get referrals from within primary care into an employment sector, having had conversations with the employment sector that basically said, yeah, there's a lot of people come to us, when I say employment sector, let's say job centre for the sake of simplicity, saying, yeah, a lot of people come to us with health conditions and employment limiting conditions, and we don't actually know what to do. We don't have any interventions to enable them to get back to work more quickly. And equally, similar conversation across primary care, GPs primarily, that said, fundamentally, we recognise that probably 75% of the people of working age that we see, the best intervention that we could give for them would be a good job. But we don't have a door to send them through. So if they break a leg, or if they cut their head, or a variety of different conditions, we know pathways. We have pathways for those. We don't have a pathway into employment. We'd like to create something like that. So to a certain extent, I guess the first point about that was that we tried to bring at least two sides together quite early to say what does that mean, and what bits have we got in common, and what are the things that each side can help with. That's in terms of, essentially in terms of primary care and the job centre, crudely. As this has evolved, we had politicians in Sheffield in particular. First thing is, I will bounce around between Sheffield and the city region because the politics is tricky, and therefore if I say Sheffield when I mean Sheffield city region, please don't get angry. That's just for the people back home to get angry, if that's okay. So we had a member review of exactly what was happening in Sheffield City Council on this agenda, and then we started working within the devolution pilot, whereupon our devolution agreement in the Sheffield City region involved having an employment pilot essentially mirroring what was the work programme and has now become the work and health programme. So then we've also, on the back of developing that sort of regional agenda, we also, working within the health system, started to develop the idea of employment as a fundamental part of the sort of long-term prevention strand of the Sustainability and Transformation Plan. And that sort of business case has been bought into, and we're sort of working, that's now cast in stone, as far as anything can be cast in stone within the NHS, to say, okay, that's part of our prevention agenda, is around employment within the STP. Where are we going to? Crudely, we want a simple referral route. There are a number of different projects going off across the city. And one of the things that I mentioned earlier was the idea of establishing a baseline. And I guess that's one of the first things that we did that was quite useful. So it was a baseline study that was commissioned by 3 colleagues, one from the university, one with a background in DWP policy, and one a local VCF provider. We essentially did a baseline study around where are we at within the city region in terms of employment and disability. What are the flows in terms of the job centre narrative? What are the flows on and off of disability benefits, essentially the ESA type benefit? Where do they go to? Do they go into work? Do they go into job seekers allowance? Or do they move into economic sort of inactivity. And then in terms of the health system, what are the conditions, what are the interventions, what are the pathways, what are the numbers, what does good look like? So even in terms of, for example, the public health outcome framework measures, what does good look like in terms of things like employment opportunities for people with learning disabilities or on a care programme approach within mental health services? What are the numbers? What's the ambition? Just simply quantifying it to start with helps and creates a bit of a framework. One of the first things that we found in looking at this is that there is probably an enormous amount of activity going off already across adult social care, across learning and skills teams, across the NHS, across other local authority departments, including public health, across the VCF sector, across employers, either through corporate social responsibility or organisations that just do stuff, and a remarkable number of those that just do things, don't actually ask for any particular assistance or any particular pathway, just get on with it. And I guess that was a key point for us, that there is an enormous number of pathways that exist already, maybe at quite a small scale, and certainly not connected at all. So in terms of commissioning frameworks, we found that there were people doing very similar things within, in my world, adult social care and learning and skills teams that had never really had a conversation about what their commissioners were trying to achieve or how they were trying to achieve it, but were essentially trying to provide employment opportunities for people with health conditions and disabilities in different ways. And that equally applies within the NHS, particularly in terms of commissioning within mental health and learning disabilities. So the first thing to do is to say, what have we got? Does it make sense? Does it make sense to us as sort of people within the commissioning framework? But more importantly, does it make sense to people that are trying to use these services? I'm fairly confident that when you ask that question, people will say, no, it doesn't make sense. We have no idea how this works. I suspect that if even within this room we could get half a dozen or a dozen people to put their hand up and say, well, we're working on this, but actually probably there are other people that you didn't know were working on it within the area. It's an astonishingly quite anonymous, sort of secretive world that I don't really understand how that's emerged, other than it has evolved rather than being strategically developed. Maybe arising from legacy stuff from public PSA agreements and local agreements and a variety of things. But I think the first thing to do is to try and get a handle of it and get a handle on the numbers and the amounts and the strategies and exactly just simple things like commissioning dates. How long is it for? What's the organisation that you're commissioning? What are you trying to get out of that? Are you going to change it? Is it based on evidence? There are some things that are happening that are still in our area, still cockeyed, that don't make much sense, that really aren't based on best practice, but are based on custom and practice. So there's some learning there that I would suggest that it's really worth having a look at that as a starter. But the simple destination is a very straightforward referral route, both in and out, so in terms of, for example, NHS and local authority commissioners, and also within the employment world. The other thing that you may well find on the back of this complex landscape is employers being approached by a dozen different organisations trying to find employment opportunities. It's not helpful for employer engagement. This is not simple, but it's not where we're at now. It's just by way of indication. This is a quick draft of what we would like to achieve that we drafted up 2-3 years ago. It's moved since then, but strangely, there's still quite a lot of those existing things, things still in existence, but it has moved on a bit. But essentially what we're looking at is trying to create a local integrated employment support system within the area. I think some of the things maybe have got bigger. There are a variety of, for example, I think on the STP didn't exist. It hadn't even been sort of published when we produced this diagram, which is why it doesn't feature. But I'm not going to go through it. Life's too short. It'll have moved on by next week. But it's just an indication that that's what we sort of tried to get down at the beginning. Where we're at now, we've secured some money. I'm very conscious that this presentation talks a lot about the money and the organisational aspects and don't really feature that strongly on actual outcomes for actual people. That's probably a fair reflection on where we are. We've done some, we have got some outcomes, but the truth be told, we've been spending a lot of time trying to get organisational alignment and narrative and an agreement on what the agenda is and an agreement on what the different organisations should be doing towards it. We have secured some funding. Obviously, we had funding anyway for the Devolution pilot, so that was a first pot of funding that existed. Then along comes Building Better Opportunities, which is the lottery fund, which is essentially a social inclusion project. So a housing association, a VCF sector organisation gets that. We're still spending £1 million across a variety of small commissions across the Sheffield area alone. We've also been successful provisionally in securing £5 million from the Work and Health Unit for from the Innovation Fund, basically looking to provide increased employment support using what we're describing as an IPS light model, individual placement and support, a model traditionally associated with people with more severe mental health conditions, but being implemented for people with sort of mild to moderate mental health conditions in the case of the pilot, along with a similar sort of intervention for people with MSK conditions that are preventing them going into employment. We've also, in the first phase of the IAPT, increasing employment advising IAPT, which creates an interesting dynamic because already those two are in conflict. And we've actually had conversations to say, can we put these two together? And we're fairly optimistic that we've been able to do that with the Work and Health Unit. So it will be a single intervention across the piece rather than trying to keep two separate randomised control trials within the same area separate. The most important thing that we've got is a desire across the health organisations to do something about it. So that's across the CCG, across the hospitals, across the health and social care trusts, to say, yeah, we are doing stuff, but we're not doing enough. And yeah, we're not doing stuff that is in any way collaborative, and we want to do something about it. That was like quite a coup. That took a long time for that to get across. And the other thing is that those organisations are quite small, quite disparate. So I'd say the first thing in terms of the lessons is agree the mandate. So agree who owns this, who's carrying it, who's responsible for it, and then agree a narrative across the organisations that said, yes, this is what this is about. As Shelley stated earlier, it's a very diverse agenda. It's very difficult to pin down in terms of actually what's in and what's out of this. I think it's important that that's done. It took us ages to do that, and we're still not there. But I would have said if I was starting again, I'd say let's be clear about what this is right from the very beginning, so we don't get either scope creep or we don't get people saying, well, you've missed X, Y, or Z. Understand your numbers. I've said that. The numbers, the landscape, and the evidence about what works, that's quite spread out as well, and it may be a perfect place for this network to provide some input into this. And there are a variety of networks that exist out there already. But it's useful to have that, because the first questions that we asked by politicians or members of the public, well, what shall we do then? What works? What do we need to do? Get to know each other. My point there says it's everybody's and nobody's agenda. Because it falls between two or three different places, it's very easy to get lost. And therefore, it's quite, you do have to sort of spread your net in terms of your contacts and know people in different areas. Pictures are good, words are hard in this agenda, but pictures can be very effective. As Shelley's diagram indicated this morning, I suspect that people will be picking up the pictures and saying, yeah, I get that. There's a lot of knowledge and history in providers. Don't assume that this is all about the statutory sector. It definitely is not. The best examples of good practice that we've got in the Sheffield City region area are essentially from VCF providers. So please take the knowledge and the awareness that you've got in the VCF sector and try and use some of it. The NHS is very important and very disparate. It's not one organisation, it's dozens. You will have to sort of do a bit of analysis on what those key stakeholder areas are within the NHS. Cultures are massively different. The other thing that happens here is the culture within Job Centre and the culture within the NHS areas and the culture within 2 or 3 different local authority areas, just in terms of what they're trying to achieve, how they try and achieve it, what are the buttons that you can press that work for them, that make them want to work on your agenda on this, are very different. We found that very quickly, just across GPs and job centre. The job centres were particularly interested all of a sudden in people claiming employment support allowance because it was coming onto their agenda in terms of one of their targets and therefore suddenly became important 2 or 3 years ago. And then all of a sudden that helped. So learn what the targets are, especially in some of the organisations like job centres. One other thing is, I think it's very important not to be precious about roles and titles. Health trainers, job coaches, work coaches, employment advisors. I could go on. There are lots. And people think, oh, they're not one of them, they're one of them. Well, to be honest, I've been around it enough now to realise that there's hardly any difference between half of them. They're just from different organisations with a slightly different take on things. So you might want to create your own little language amongst this lot that says, yes, we understand what these people are, and yes, they don't have to be in a job centre or in the local authority adult care or in the NHS's adult social care team. There will be people doing very similar jobs in different organisations. And we're starting to think maybe we should just develop a sort of an agreed definition about what someone does, and then they can be anywhere. Classic example is IPS workers and job and employment advisors in IAPT are really hardly any difference apart from the cohort, the type of person that they speak to. And that can be very confusing for people like you and me. So don't be afraid to ask about that stuff. So anybody that thinks, I don't quite get that, do ask, because you'll probably be right and that it's really not that different from somebody else that you thought, oh, I thought it was different, but it sounds like it's the same. It probably will be the same. Don't forget the demand side. Employers. What do they want? From what we've gathered, essentially what employers want is they understand the agenda, they want to help, but they do want it de-risked. They want help. They want help to be at hand. They want, if someone that's got a mild to moderate mental health condition that finds an employment opportunity and then has a relapse while they're in work, they want to be able to call someone to get support in crude terms. So don't forget that side. Don't forget that it will not be all about creating an increased number of people that want to work. There will be a question about creating a number of increased opportunities within organisations that feel that they've got the support around them to enable them to essentially take comparatively a risk. City region politics is hard everywhere. I'm just saying that up front because I suspect that sooner or later you will hit that if you work on this on a regional agenda, as you will probably have to fit with DWP sort of boundaries. Then you will fall into politics around who's doing what in which area and that stuff. And the only thing I'm saying is, yeah, it is the same everywhere. So don't be surprised. It's not worse here than anywhere else. And the challenges, very quickly. Employment and skills, public health, job centre, NHS mental health teams. Do you know each other? Do you know who they are? Do you share funding? Have you got joint projects? Slowberries, it's a metaphor, sort of is. One of the things that we managed to do is we got together one time before Christmas and I found a load of slowberries and provided them to a number of different people, and then they made a load of slow gin, and all of a sudden they have something to talk about when they get together. So when we have meetings on a quarterly basis, then all of a sudden there's something that brings people together. There will always be something. But the first question is, do you know them? I did notice there wasn't a lot of job centre presence here today, for example. It would be very important, equally very important from primary care. Very, very important. So a fundamental question there. Who commissions, do you know? And are they evidence-based? I've asked you this question already. Have you got a joint plan and a shared understanding? I think, God knows the world don't need another strategy or indeed another plan. But this may be prime territory for it because it involves a number of different organisations. Strategically, does the issue feature? Does it feature in any other plans, in your corporate plans, in your strategic, in your STP? Does it feature? You may have a problem making things happen if it doesn't. But if you're serious about it, maybe it should. And do you know what the costs of failure are? How much is it costing you at the moment? How much is it costing the economic system of this area in terms of failed opportunity, missed opportunity, an exacerbation of existing conditions, missed talent, etc., etc. What does Job Centre Plus think about it? Are they bought in? They've got a massive reform agenda going off right under your noses as we speak. That needs to be tied into this. And what's the rate limiting step? Have a think about, you know, which is the bit that's holding us up in all this? Which organisation, which agenda, which part of it, which is the bit that's like, if only they would catch up, we could go faster. Need it be? Need it be the rate limit? Can you get around it? Can you get over it? Can you get through it? There will be one, and I'm not going to tell you what mine is before you ask, so don't ask the question. It's being filmed. That's essentially a very quick canter through what we've learned, ask you a few questions. Questions available.
Thank you very much, Chris. A huge amount in there in terms of kind of content and experience. I'm sure there'll be some questions. I'm just kind of looking out. There's a couple just at the front here. So yeah, we'll go straight to this gentleman here.
From the Bristol Independent Mental Health Network. I think one thing I found really interesting is about the way you got different agencies to work together. What I was wondering is what has been the role of service users and carers within that? How have they influenced the work that you've done up until now?
It's a good question. I sort of realised during the previous presentation that mine was a bit light. We have an organisation called Disabilities Sheffield within Sheffield. Again, this is a tension between locality and city region. The VCF sector has been fairly decimated, but it's not been decimated evenly across the city region. So we've got areas that have still got some infrastructure and some that haven't. And that's an issue in itself. But to answer the question, Disability Sheffield have been involved in a number of sub-projects within this, in terms of saying, for example, there was a piece of research that they've done specifically with employers, that they're doing specifically with employers, not dissimilar to the previous presentation, except on a local basis. We've had conversations with our Equalities Network to say what are the issues. So we've also had conversations with people from a variety of different disability and health condition backgrounds and said, this is what the deal is. What's your issue with this? So there's been some, but truth be told, I said at the beginning, this has been a battle about organisation. It's not a battle, but it's been a struggle about organisations and culture to a certain extent. But I'm confident that we have a number of people that we use as stakeholders that are reflecting it. But let's be quite upfront about it. It's not our strong point.
You mentioned employers. I was just wondering if you could tell us a little bit about any work you've done with them and what we could learn from it.
Yeah, interesting. Very simply, most of the employers have said we get it. Some have said we can't, or we don't want to. But some have said we really want to, but we'd like to de-risk some of the stuff. Especially, they're very aware, and also, depending which bit we're looking at. Obviously, if we're looking at people that are in work, but off work, then that is their agenda, and they are clearly interested. Although some have said, no, actually, we don't actually worry too much about it. Some of the more mercenary ones have said, we don't worry too much about it, because if someone has a health condition or a disability, then we just don't carry them. And so we don't worry about it, because people don't get paid while they're at work in lots of organisations still. And therefore, they've said, we don't worry. There are lots of organisations that said, we do worry. And one of the things that they've said for people that are in work but off work is, we would really like to make sense of fit notes. Light duties don't work for us. And that's predominantly the sort of prescription, the fit note that comes back that says light duties. And a lot of places say, we don't understand what that means. And we don't know what to make of it with an individual. So certainly the wellness recovery action planning, or whatever you want to call it, needs some work. And they've said that they'd certainly like to do that. And essentially that's a disconnect between the health system and the employer. So that's the first point for people that are in work but off work. In terms of enabling more people to get into work with health conditions and disabilities, as I said, the basic message was, we'd like it to be de-risked. We'd like to help, but we'd really like to know that if we have an employee that has a condition like that, then we can call someone. And they literally don't know who to call. Hence the idea of maybe a single health and work service across the city region that brought a number of these bits together there was a single offer to an employer, and it did everything from what's currently might be the workplace wellbeing offer from public health, that said maybe we should personalise that on an individual basis, but maybe we should also provide some of the support that's in some of the other things that exist in the city from a central point, hide the wiring, keep the commissions if you want, hide the wiring, give us a single number that's health and work service, so GPs can phone it if they're not sure about an individual and what to do in terms of the fit note process. We've had some radical thought from GPs, for example, that said, we don't even want to do it. Why does it have to be us that do it? Obviously, public health, work and health unit talk about pharmacists. GPs talk about having a single unit for doing all of their fit note stuff, potentially. Employers said it would be nice to have a single point of contact in order to call people about mental well-being at work. What's the offer? What's the products that we've got? Lots of organisations still selling stuff like that to employers, and they're really not sure what to buy. So give us some surety on the product and give us some de-risk, surety on the sort of training and facilities that we've got, and de-risk the opportunities that we might provide for people was basic messages.
As Fee said this morning, great to see everyone. This really is a unique event, not just in bringing all of the health sector or representatives of the health and wellbeing sector and employment and skills together, but actually we're doing it as West of England. You know, what we're in the room for this morning, it's not specific to Baines or to South Gloss or to Bristol or North Somerset. Actually, there are quite similar threads across the piece, and today is a significant part of how we're developing a West of England approach. I was just thinking in terms of what we've heard from this morning, it's been great to hear from Shelley. When I saw the slides about the green paper, you think, whew, there's some big grand aims in there, but that's the principle, isn't it? It's about raising the bar and raising that level of ambition about this area. So thank you, Shelley. From Chris, it really resonated for me, lots of things you were talking about in the Sheffield region of the journey that we're on, and a huge amount that we can learn from what Sheffield have achieved. And don't be apologetic about the significant level of resource that you've brought in, because that is absolutely crucial to making this work. And then a huge thank you to Leo, Anna and Charlotte for giving us that lens through looking at it from young disabled people's lens, and also the opportunities that the I Can Make It campaign can really give us, I think, to really help in developing our response as West of England. So what I wanted to do is just cover four things. My day job is Director for Children and Adults in Bristol, but in this arena I've been asked to lead and help coordinate the West of England's Employment and Skills Plan as part of Devolution. So again, like everybody, we're asking everybody in the room is sometimes you have your core job that may be geographical to your area. Actually, we're asking you to think beyond your sector, perhaps beyond your geographical area. And that's just a really important part of some of the culture changes that we've talked about and that Chris alluded to earlier. So I'm just going to quick recap on some of the regional challenges, tell you a little bit about the work that's underway already to develop the West of England Employment Skills Plan. Thirdly, to invite you from today to engage in that process. And then finally, just offer some brief reflections back that we're doing with central government partners and through our colleague here from the Work and Health Pilot. And then on to the real meat of the morning around how we develop our local response and what it means for us all in the room. So firstly, this I find hugely helpful. There's some really interesting data on this sheet on your table. We all know that outside of London, this is, I think, the second most highest growth, economic growth of all economic regions. You know, huge growth across the region. But we also all know there are huge inequalities, and we heard some of that this morning. We know we've got unemployment hotspots in different parts of the region. We've got some of the poorest parts of the region which have had little or no income growth over the last decade. And that's really driving some of the work that the West of England Employment and Skills Group are looking at. But I think one of the things that's most interesting is that pie chart, which says that nearly 20,000 people in receipt of ESA have actually got a level of mental health issues. That is a huge number of people. And if you look at the breakdown, the pie charts are broadly the same in each of the four
local authority areas. So that, to me, feels like it should be a really key part of our work in developing Work and Health Pilot. So, what are we in West of England doing, and the work that's started already around developing a really strong employment and skills?
I think you will know that we're well underway. There are elections in May to establish what will be called the West of England Mayoral Combined Authority, with a key goal around driving inclusive growth, good growth. That's a really good expression I hear. It's about good growth that's right for the region. And from May this year, central government have agreed to devolve new powers and funding to the West of England. And that is currently the 3 local authority areas of Bristol, Baines and South Gloucestershire, but we're working hard to make sure this is a 4-authority approach. The 3 main areas that we think are most relevant to the subject today is we will gain local control of the adult education budget, which could be in the region of around 20 million. We will have the responsibility for co-commissioning with DWP and others a work and health programme. And a bid was submitted by the team on Friday night, burning the midnight oil, around an employment support innovation pilot, where we're being quite actively encouraged to bid. So the team are working hard to do that. But actually, the team, we're looking beyond that. That's 3 key areas. And what we really want to do, we've got real backing from the politicians, business leaders, is to have a very confident statement as a region of what are our priorities, what are our inclusive priorities around employment and skills for the region. And that's why today's event is such an important part of the development of that. And from February, so starting later this month, over the next few weeks, we want to get your input and feedback to the developing employment and skills plan. We'll be putting something out called a positioning statement, deliberately to really start, you've got to start somewhere, but to really get that co-design around what the critical priorities should be. And that'll be going out across the sectors, and we really would want your input as to that we're reflecting the work and health priorities right. So we really want to hear from you today during the discussions, and I'm going to ask the team who are here to stand up. So if you want to make sure you've made that connection, today is all about connectivity and collaboration. So I can see Kate from Baines, Henry from the Local Enterprise Partnership, Jane from Stay Standing, Jane from Bristol, Julie from South Gloss. Is there any other colleagues in the employment skills work stream? Excellent. Paul, I'm sorry, I can't quite see everybody. Tracy, I know. So this group of people are working to get that connectivity around employment skills and want to get the input to ensure that we're reflecting those health priorities and employment into work for people with long-term conditions and disabilities. So please speak to them during the morning. But a strategy won't deliver it on its own. And I think we have to be honest with ourselves this morning, is that we're doing this at a time of significantly reducing resources and challenges across all of our sectors. But something that really struck me in what Chris said in his presentation is you've got to start by, you spend a bit of time working about who you are, what you are, how you're working as a framework, and what some of those priorities are. So I firmly believe that if we have that really confident statement of this is us of West of England, this is our intentions, these are our priorities, it will enable us to, 1, bring in additional resources, be that from central government or elsewhere, ensure that we're able to target our own resources well, and ensure that we can put our energies against a clear set of priorities. So a strategy isn't everything by any means, but I think the work we're doing today will help us develop a really clear strategy that will really then help us all make a strong impact. So I think that's really all I'd want to say this morning. As I say, this is a West of England approach. And I've said to Shelley, and I know that our political leaders are doing the same nationally, but I think through the Work and Health Unit as well, I think the key message that I'd like to give is that we're here to do business regionally. The commitment that's in the room this morning shows that people are really committed to joining up that health and employment and skills sectors, to really join up how we do this. And I think we need to give that message back to our colleagues at the centre, is that we really embrace the Green Paper. We will respond formally during the consultation, but also that as West of England, we're gearing ourselves up, ready to make sure that we're able to deliver. So thank you, that's all from me. Looking forward to the discussion sessions now, where we can really get into some of the meat of how we do this.
I'm Becky Pollard. I'm Director of Public Health for Bristol City Council. I couldn't be here for the first part of the day, but I'm just so delighted that this event has taken place, and there's been such a great broad diversity of organisations and individuals across the wider West of England partnership. From a Director of Public Health perspective, the whole interface between work, health, employment is absolutely key in terms of looking at the wider determinants of health and how we keep people well, how we support people into work, but when in work, keep them healthy, and give work, because work is good for health. And certainly my colleagues across the other 3 local authorities and myself, the Directors of Public Health, are working very hard to try and coordinate and support this whole agenda. And certainly we've been supporting Liz and Jan and David in terms of where we go next. So in terms of the next steps, I wanted to just reassure you that certainly as Directors of Public Health, we're absolutely committed to taking what's coming out of today to drive that forward. We meet regularly, and I think we're having a report back on the 10th. Paul Scott, who's a public health consultant, is coming to talk to us. So all the messages and the issues that are coming out today, they will be written up. They'll be on the Bristol Health Partners website shortly, but we will also be taking those messages to see how we can take forward some of the issues. So just a few key steps, I think, from my perspective. Firstly, obviously the consultation, the Green Paper, Improving Lives. What an opportunity we have to really give some key messages back to central government. So we're urging, I think, like the speaker said earlier, do put a response in. We'll be doing a collective one as Directors of Public Health. We'll also be encouraging our local health and wellbeing boards to put in a response. But we'd encourage, all of you to do that. It seems like quite an onerous task. I think Liz was saying there's about 42 questions, but even if you don't answer all of those, I think if we do at least respond in some way, it sends a very clear message of how important we think this is locally. I think a couple of the key messages have come out for me is the importance of service user perspective and how essential that is, and how we have to use our local networks to make sure those local voices are being taken on board and acted on. It will be challenging, but I think the other thing for me, and I was sort of sitting in on the table about the partnerships and how we take this forward, we do need to take a strategic approach to this whole issue. There are different lenses you can look at through health work, health. We need to use those partnerships and take a strategic sort of overview of how we can work together. And the Sustainability Transformation Plan, the STP, is, I think, a really key structure partnership that's emerging from the health perspective, but with local authorities, to look not only about getting people into work, but also promoting health and well-being of people in work. And I mean, the NHS alone is such a huge employer that there's a big responsibility there, I think. So we need to keep sort of advocating, keep the voice of work and health at the strategic level. Health and wellbeing boards are key as well. They are the statutory body that brings together partners across a local authority area to look at improving health, but also reducing health inequalities. And I think you heard this morning, you know, that there are big inequalities of opportunity, of health outcomes linked to work and worklessness. And I think the final thing I just wanted to say, I guess, was looking at the opportunities we have around Bristol Health Partners as well, of looking at innovation, looking at research, looking at what's working across the country and pulling people together to really, you know, look to see what else we can do, and particularly around data. The group at the front here looking at data is saying, what do we know, what don't we know, where are the gaps, how do we share data across different parts of the sector. Not always easy, but the whole health integration team approach, the HITs that Bristol Health Partners offers, may be a really good opportunity for us to think about a work and health hit to try and look at some of the difficult challenges around data, but also about the evidence base and what it tells us. So if anybody is interested in that as a way forward, then do let Jan or Liz know. But we do have all your emails as well, so as long as you're happy for us to contact you, if that progresses, then we could put a call out if anybody's interested. So I think I'll stop there just to say, you know, really exciting. I look forward to seeing the report from today and to go back to certainly to my colleagues in public health to see how we can continue to support this work. And maybe, I don't know, in a year's time, we might even come back together again to just review where we've got to. So I'll hand back to David, and thanks very much.
Thank you very much, Becky. There's been many people have been involved in making today happen, but there's three I'd like to just thank in particular. Jane Taylor, sat on the, over there, Liz McDougall and Jan Conlitz, who have basically done a huge amount of work to bring this from kind of outline concept to reality. So thank you to you three in particular, and thank you to everyone who's been involved, our speakers, and all of you who've given up your time to come along and kind of share your ideas and commitment to this issue this morning. Hopefully we won't disappoint in terms of what we do next and the way in which we bring your discussion together. We have a great opportunity to, you know, do this better locally. It's obviously got a national priority, and hopefully this will be the start of some work that will make a difference locally. So thank you for getting involved.